No, the resurgence that we are seeing right now is a continuation of the first wave that caused us to shut down our community 3 months ago. These new cases are a result of people not wearing face coverings in public and businesses not following the state's protocols for reopening safely. At this rate, if we don't change our behavior, we will have to return to a stay-at-home order, and that would be devastating to our economy and to our citizens who are just now emerging from a stay-at-home order. As you probably heard this morning, right next door, the governor of Texas announced he is once again shutting down businesses after the state saw a massive increase in new COVID cases in the recent weeks. Here in Baton Rouge, we saw an outbreak this week attributed to our local bars. Now, I think it's imperative that we all stop and ask ourselves if our actions are putting our lives and the lives of our family members and our neighbors, our loved ones, at risk. With that being said, I really need our business community to lead by example. I need our business community to step it up. There are far too many businesses in this community that are operating without the proper precautions. Employees are not wearing face coverings, and that needs to change. There has been a mandate for all restaurants, bars, and coffee shops that everyone, the employees especially, must wear face coverings while at work. Restaurants, coffee shops, shopping malls, salons, barbershops, casinos, and gyms are not allowed to exceed 50% of their total occupancy, as determined by the state fire marshal. Bars are not allowed to exceed 25% of their occupancy if they do not have a food permit. And all waiting areas, buffets, and common food stations must remain closed. And all of these businesses must regularly sanitize and disinfect public surfaces. I really need our residents to help hold our businesses accountable. If you see a business that is not enforcing proper social distancing, not providing sanitizing stations for patrons and employees, and failing to comply with face coverings and glove guidelines, you can report them anonymously to 225-389-8875. That number, once again, is 225-389-8875. You can also report them online at brla.gov/COVID report. That's brla.gov/COVID report. You can also use this information to report large crowds that are above the required amount. You can use this number to report that as well. During this pandemic, one of the most important things that we can do is wear face covering when we are in public. You know, this is not a Republican issue, it's not a Democratic issue, it's the right issue. It's the right thing to do if you're concerned about your health and the health and well-being of your neighbor and your family members. Numerous studies show that if everyone wears a face covering in public, it will stop the spread of this virus. It's very simple. So I am appealing to everyone to wear a face covering. Businesses, please make sure that your employees are wearing a face covering. You know, I have had a number of individuals who have called me, they've sent me emails, and they've asked me, Mayor, make wearing a face covering mandatory. And my reluctancy to take that step is because, first of all, enforcement issues. Our police are already doing their best to apply public safety across the board. To put another level of having them write tickets of misdemeanors, I don't think is the appropriate thing to do. In fact, during this whole season of COVID-19, since we started, we suspended misdemeanors. So I don't want to go back to that. In addition, let me just say this. We just lifted evictions. Then, in addition to that, many people have been laid off. Many people have experienced furloughs. Families have been financially challenged. So why would I add a fine onto a financially challenged family or individual that they probably cannot pay at this time? So that is why I'm asking people to do the right thing. But let me just say this, I am leaving my options open. If we continue down this path and our cases and hospitalizations continue to rise, I will look at additional measures to take. So once again, I need everyone to wear a face covering, wear a mask. I also need individuals to take advantage of testing. We started the first testing location here, our Mayor's Office of Homeland Security, in collaboration with all of our hospitals on March 17th. It was the first drive-through testing site. I'm happy to say that now here in the parish, we have over 22 testing sites. So testing is readily available and accessible to anyone, no matter what zip code you live in. And now, in addition, the state has applied also contact tracing. And so if you're called by a contact tracer, please answer their questions. The call is confidential. And I sound like a broken record. You hear it from me, you hear it from everybody else. It's very simple. Sometimes all we have to do is just follow the instructions. And the instructions are, wear a face covering, practice social distancing, and practice good hygiene. Now, when I first started down this path, one of the individuals that I spoke with to get wise medical scientific counsel from was Dr. Katie O'Neill. Dr. Katie O'Neill is an infectious disease specialist at Our Lady of the Lake. I'm going to ask Dr. O'Neill to come up, and then she will be followed by Dr. Don Marcel, who is the medical director and who has been working hand in hand with my administration as we've navigated COVID-19 for Region 2. Dr. O'Neill?
Thank you, Mayor. Good morning. In the last couple of weeks, it really feels like March. And we're here again talking about the same thing that we talked about then, but with a lot more knowledge. In March, we saw so many people who began to come to the hospital with respiratory illnesses, and we didn't know how they were getting it, and we weren't sure of what was causing the spread. In the last week, we've seen the same thing. We've seen an increase in the amount of people seeking care for respiratory illnesses, but this time we do know what they have because we have tests available. We see more COVID-19 coming to the ER, and we are once again admitting more patients with COVID-19 than we have in the last 6 weeks. It's been a very startling last 7 days because it's happened so quickly. As opposed to March, we know what works now. So we know that if we do the right things in the community, we can stop the spread. What we are seeing in the patients who are coming into the hospital is that they have loved ones who have tested positive, or they have been to social events in which they have become exposed to people who were positive. We know how to prevent those things. And today, everybody in this community can do two things that can help our community from going back to phase 1, going back to stay-at-home orders. Those two things are, number 1, taking care of your community, and number 2, taking care of yourself. How do you take care of your community? The first thing you do is you put a mask on. A mask scientifically has nothing to do with who you vote for. It keeps your respiratory droplets contained, and that is how this virus spreads. So if you are going to be amongst your family or amongst the community, you should have a mask on. It is not for you. My mask is for you. It's not for me. It's for my mom. It's for my dad. It's for my diabetic coworker. My mask is to protect the community. The other things you can do are you can step back. So if you don't have a mask on or I forgot my mask, I shouldn't be within 6 feet of you. You can hear me just fine. And in our workspace, we should be separated by 6 feet or we should have masks on. You can seek a test when you don't feel well. We have tests available, something that was dramatically not here in March. So if you are feeling poorly, you should seek care and you should seek a test. And that will let your family members know whether you're a risk to them. The last thing you can do is you can answer the phone when the public health department calls for contact tracing. That is a vital piece of stopping the spread. People have to be willing to tell the public health department who they've come into close contact with. That information helps us to keep the spread from happening and helps us to keep the people who you may have contacted safe. They can get a test. They can stay quarantined at home. If we do all of these things, we help our community. How do we help ourselves? We wear a mask, absolutely. That is an added layer of benefit, but we have to stay healthy. If you are diabetic, if you are overweight, if you have chronic lung problems, if you have heart disease, you need to be seeking care with your doctor. You need to be exercising. You need to be making sure that you have the right medications. You need to be as healthy as possible. This is a marathon, and your health conditions will affect you for the next year, long before a vaccine is available. Please take care of yourself, and please take care of our community. The patients we admitted in the last week, they got it from people who feel well with this virus, who are going about their regular day. I need us to start to focus on how to protect them. I think we can do this together, but what I am afraid of is that it took 4 weeks to go all the way back to feeling like we could breathe in the hospital again. It took 4 weeks before cancer patients could get their surgeries again that were needed. We can't reach that point again where we stop medical care for the well. So everybody in the community has to do their part so that we can continue to seek care for COVID and we can continue to seek care for ourselves. Thank you for letting me be here today. I hope that we're not here in 3 more months. I hope that we can set a tone that continues through the fall, but we need your help. Dr. Marcel.
Good morning and thank you. My name is Dr. Marcel. I am the Regional Medical Director for LDH, Office of Public Health. And listening to Mayor Broome this morning and Dr. Katie O'Neill, I hope that what they said was not just heard, but also internalized. I can only echo what they said, not because there's nothing else to talk about, but because it is that important. And it makes that much of a difference. These are simple measures. We do not misconstrue simplicity for ease, but they are nonetheless simple measures that from a public health perspective, we know they work. We don't have to ask what if. In fact, our own numbers demonstrate what if when we look at the numbers that we had when we were staying at home and before we progressed in faith and using the data as well to phase 2. And yet here we are. I would like to echo the mayor's concern for the rise in numbers. It has been rapid. It has been rapid. I would like to echo what Dr. O'Neill stated about the fact that it's important to take care of ourselves and take care of our communities. It is doable, it is important, and we don't want to be here in 3 months again saying the same things because we didn't do this. We can track the data, we can put it out there, we can make the recommendations, we can share the facts and the information and the current status on the updates in the hospitals and whether or not we have beds or vents available to take care of the people who suddenly need them. Again, when we got through that once. But we can come back here to say it again, but at some point it's going to be beyond what we say and what the numbers show. It's going to be what y'all do. It is going to be the choices we make and what people choose to do, both for themselves and for others. I cannot reiterate enough that when I wear my mask, it's for you. When you wear your mask, it's for me. And in the dramatic or significant increase in positive cases that we have seen in the last week, not the last month, in the last week here, 95% of that spread is community acquired. And what I mean, that's from us walking around and about without face coverings, without practicing social distancing, in addition to washing our hands like we should and using hand sanitizers. And for sanitizers to truly be expected to be effective, they need at least 60% alcohol in their ingredients. It's really just that important. In addition to the measures, the public health measures of wearing a face covering, practicing social distancing, and hand washing, testing and contact tracing are believed to be important measures that can help us mitigate the spread of this illness. Now, that's something we have to work together on. We don't expect you to individually do that, but at the same time, we cannot do that without you. As stated by both Madam Mayor Broome and Dr. O'Neill, Baton Rouge has seen a significant and meaningful increase in access to testing. You can get testing through your doctor. If you do not have a primary care physician or provider, there are federally qualified health centers throughout the parish, and there are also community-based testing sites through the Office of Public Health and the Louisiana National Guard. There is access. In addition, contact tracing. Now, we understand you might not answer a phone number that you don't know, especially if it's a toll-free number. We get that. So we want you to know the number is 877-766-2130. You may or may not know that you've been exposed to someone, and we can't tell you who that person is to respect their medical privacy and HIPAA laws. But we can ask questions to ensure your safety and the spread of others that you may come into contact, especially if you never develop symptoms, because we also now know there can be asymptomatic spread. It is not meant to be an imposition to your privacy or a disrespect of your personal right. It is an effort to learn more so that we can do more to help more people, to keep us alive and well, and to prevent unnecessary but significant illness and even death. I want to reiterate that the community-acquired transmission is what we believe to be the primary cause of spread in this recent uptick that we are seeing, that we are observing right now. Initially in Louisiana, in New Orleans, as well as in the state, in the country, in Washington State, the initial cases and clusters and outbreaks were directly linked to nursing home facilities and congregate settings. That isn't the case anymore. Of this increase in the last week, 95% of those cases were people who did not live in congregate settings. They were not in congregate settings. They only comprised 5% of these positive cases in this last week. So it's us going out and about. And just like we made a difference when we did not wear face coverings, we can make a difference when we do, as we have already demonstrated late May late May. Lastly, I would like to say that LDH realizes that the impact of COVID is multifactorial, it's multifaceted. It comes in a lot of ways, and one of those is also the mental health impact and the strain it could have on people with worry, with anxiety, for so many different reasons and based on your personal history. So I'd also like to mention, in addition to the Keep Calm Through COVID number that's on the website, ldh.la.gov, in the last week or so, there has been a new behavioral health recovery line that has been implemented. That number is 833-333-1132. And you can call that number, talk to somebody if you're worried, having a bad day, need access to resources to help if there's any strain or stress or any behavioral health concerns that you may have for yourself or a loved one. Can one person make a difference? Yes. The answer is yes. It may seem like a little thing, and it may be a little thing. It's certainly simple, but it means so much. It means a lot. And if you wonder, if you have any doubt, does it matter? Yes, it does. Thank you. Be safe and stay well.
Thank you, Dr. Marcel and Dr. O'Neill. In closing, before I take a few questions, there's no doubt that you heard the passion in my voice as I was speaking, and that comes from a heart of wanting to see our community, our citizens, and our residents thrive and prosper, and not only in their soul, but in their physical bodies as well. And so I don't want to see us regress backward. I want to see us move forward so that we as a community and each family can achieve the goals that they have for themselves. The truth of the matter is, and you know this now, that there are individuals between the ages of 18 and 24 who are now suffering from COVID-19. And while many people survive COVID-19, a great number of people die as a result of it. So let's all do our part, as it's been said over and over again, to minimize the impact of the coronavirus in this community. I'll take some questions if you have any.
Mayor, if you file a report with the new reporting service that you guys are launching, walk me through the steps, what happens and how it's implemented.
Okay. So if you anonymously report the non-compliant businesses, what will happen is that information will be passed on to the Baton Rouge Police Department. As you know, early on in this process, when my office or others received calls, we would pass it on, and our police department would go out and politely ask people to comply. Hopefully we won't have a deluge of non-compliant individuals, but if we do, we will certainly act accordingly. Now, if we get repeat offenders, then I will take additional action within my power, certainly engaging the state fire marshal, and make a decision in terms of whether that business should remain open or if it is certainly creating unnecessary havoc to the health and well-being of our community.
Mayor, what do you say to like a lot of business leaders who kind of get agitated and feel like they're being called out as being for the issue? They were pro and they're saying that no one's mentioning those as a cause of the problem.
No, I'll mention it all. You know, first and foremost, I am thankful that we have a group of business leaders who work hand in hand with me through our Restart Baton Rouge project. And these business leaders who represent a diverse business culture from across our city and parish, they are aligned with compliance. As it relates to protesters, the peaceful protesters, there was a group that was out last week that initiated an event. They had signs up encouraging social distancing. They were passing out masks. They were providing testing for individuals. So I believe they are certainly health conscious in their processes as well. As you know, many of them feel committed and rightfully so to their cause, and sometimes the cause can dictate immediate action, which is what they did. But I think to the best of their ability, they tried to comply with social distancing in some cases. Not all the protests, of course, but at minimum, they were wearing masks. Yes.
You mentioned the younger age group that is seeing cases rise amongst them. Data from the Louisiana Department of Health shows that people between the ages of 18 and 29, that age group has the most cases in the state since this has started. What do you say to them, especially a week out from the COVID cluster that was found in Tigerland?
I say to the age group of 18 18 through 29, you know, sometimes as young people, I was once a little younger than I am now, we have a tendency to think it won't happen to me. We have a certain level of invincibility mentality, but they need to know that they too can succumb to COVID-19. Also, as I was having a conversation with Dr. O'Neill and Dr. Marcel, the other side of that coin is that even the younger people who are testing positive, they put their mothers, their fathers, their grandmothers, their grandfathers, their siblings at risk as well. And so people often talk about the humane thing to do and being concerned about humanity. If you are concerned and have a moral compass as it relates to being concerned about your family and your friends, then please just follow these simple guidelines. Don't put yourself at risk, don't put your family at risk, and don't put your friends and neighbors at risk.
Given that Baton Rouge is the state's largest college town, is this a unique problem to our city, and should we respond, say, differently in Baton Rouge than they are in Lafayette or Freeport?
Good question. I don't think it's unique. I'm going to ask the experts to come up here maybe and speak to that. But you certainly provoke another thought. I believe that the student government leadership at all of our universities should be on the forefront of helping to encourage and implore compliance with these best practices to avert COVID-19. Dr. O'Neill, you want to speak to the fact of us having a college town?
I think for multiple reasons, our region is a little bit different than other regions in the state. We are a college town. We're also the center of the government. We're also larger. But each region in the state, if you look at the map, is a microcosm of what's happening here. They saw the activity later because the activity spread slowly. But now they are doing exactly what we saw in March and April, which is that they're having an uptick, they're having an increase in hospitalizations in the Lake Charles area, in the Lafayette area, in the Alexandria area. Each area with a college, maybe it's smaller than LSU, but they all have learning institutions who are ready to go back to school, and they have the same age group bump that we have here. So I think what you're seeing is just on a smaller scale, the exact same thing play out. What each one of those regions doesn't have are very large medical centers. Those very large medical centers are located in Region 2 and also in the New Orleans area. And so we worry about that spread that we didn't see in March. We were at capacity. Our hospital was full of COVID-19 from this area. If we have to start to support the rest of the state as they have COVID-19 activity but do not have the ICU capability, we don't have enough beds in the state to support the entire state having a surge at the same time. And if you look at the map, that's what's happening. So I think we're speaking to every person in the state ages 18 to 29. Please social distance, wear a mask, gather in smaller groups. You will affect your community, which in turn affects our community as well. Dr. Marcel?
In addition to everything that Dr. O'Neill said, and to reiterate from the mayor, that really was a good question. LDH watches that across the state in every region, and we do have colleges and universities across the state, and we are seeing that uptick statewide. New Orleans also had recent clusters associated with high school graduation activities, and again, it's that same age group. And we are concerned, and while they may have the hospital infrastructure able to accommodate any acute illness, as Dr. O'Neill said, the state does not, and the state will look to us, and they will need us, and it's important, not just here locally, but across the state, that everywhere. And we are seeing upticks in Acadiana, where you have ULL and other schools. It's actually noticeable, and we are seeing it, we are watching, and we are preparing for it.
If I may, I want to revisit your question, Terry, about the businesses, because I gave some thought to the fact that our businesses should be our partners in making sure that we don't go backwards. Why? Because if we regress, then businesses regress. And so for our businesses to be sustainable in phase 2, so we can move to another phase, I need their help. And they can help all of us. So in no form are we picking on businesses, but we realize the impact that businesses can help us in helping and encouraging and imploring others to comply. I've talked to a lot of business leaders, and I know they want to remain open. They don't want to have to close again. They don't want to have to downsize their capacity again. They're just getting up and running. So with their help and with their assistance, they can maintain a level of economic stability and not have to close. So it's certainly mutually beneficial for our economy and for our citizens' well-being. Any other questions? Thank you guys so much for coming out, and stay safe.